Thank you very much for the invitation to come and speak to you today. I really appreciate the time that you're giving us. As was said, I'm Tim Woodhouse. I work for the public health team at KCC, but here today really in my role as the coordinator of the multi-agency suicide prevention steering group, which operates across both Kent and Medway. And over the next few minutes, I'm going to just talk to you around some of the structures that we've got in place across Kent and Medway, some of the latest stats that have been touched on already today. I'm going to concentrate quite a lot about release the pressure, and then also try and tease some work over the next 12 months if it comes off. Okay, so the theme or the title of the conference today is Better Together. I think we're doing quite a good job in terms of suicide prevention already within Kent, in terms of bringing people together. These are some of the groups that are represented on the multi-agency steering group that we've been working to over the last number of years. It's not everyone, there are more individuals and organisations represented, but it gives you a flavour of the type of organisations that come together on a quarterly basis to discuss suicide prevention, strategy and action plan. We have a current suicide prevention strategy across Kent and Medway that runs from 2015 and 2020 to 2020. It was that steering group that I showed you just a minute ago that developed the strategy, and we follow the priority areas that the National Suicide Prevention Strategy follows as well. So reducing the risk of suicide in key high-risk groups. We've already talked about middle-aged men today. We've talked about perinatal and postnatal women. We're going to talk a little bit more about students in a few minutes, but those are some of the key high-risk groups. We want to also improve, number two is improving the mental health of everyone within the community across Kent and Medway. And I won't read them out, but those are the other areas that we want to work in as well. So making it harder for people to take their own lives, providing better support to families, etc., etc. This is a very quick slide which shows some of the highlights that we achieved last year. So we don't have a direct budget attached to the steering group. What we have to do is influence other people's budgets or try and find funding for our own work. We secured some money from Health Education England, which allowed us to train 750 people last year in suicide prevention. We undertook some research which shows that probably not surprisingly, suicide rates follow the deprivation rates. So I was very interested to hear Dr. Brown talk about the life expectancy going down in the more deprived areas. That is also true of suicide rates. I'm going to touch on release the pressure in more detail in a minute, but we've also developed a children and young people focused elements within the suicide strategy and action plan as well. And the last point around suicide safer universities is the subject of Ian's slide, so I won't touch on that. Despite all of that work, the latest stats show that Kent and Medway are above the national rates. So you can see there we are above the national rates and the South East England averages. And that is true particularly of men. So the areas highlighted there show that both Kent and Medway are quite significantly higher in terms of rates than the national average. We've touched on that middle-aged men are a high-risk group. This slide demonstrates that. So the numbers at the bottom are age bands, and the number of the vertical axis is the number of deaths that we're expecting to see on average per year. Blue bars are men and reddish pink are women. Quite gender stereotypical, I need to change that. But it does show that middle-aged men is where the high risk is at. And I was doing a similar presentation last week on International Women's Day, and actually that kind of highlighted to me that actually we shouldn't forget that the gender gap closes significantly when we get to older age groups. And reflecting on some of the things that people have been talking about, social isolation and loneliness in old age, I don't know whether that's what is behind the gender gap closing within the older age groups, something for us to look at next year perhaps. Again, this is a stat that's been referenced before, but it's really worth emphasising that approximately 80%, and it varies within each year obviously, but approximately 80% of people who take their own lives are not known to secondary mental health services, which obviously provides us with a challenge of then how do we reach these people, how do we influence them not to follow that course of action. So that led us to think, well, if we can't reach them through secondary services, how else do we try and reach these mainly men? So we ran some focus groups down in Folkestone, but I think that what we found could be applicable to anywhere within the county. And this is what the men told us, that they feel hemmed up by the pressures of modern day life. They don't necessarily feel that they are mentally ill, but they are very concerned about kind of real life problems, whether that's money worries, whether that's relationship breakdown, whether that's contact with children, etc. And I'm not going to read them all out, but I think that the quote on the top right, my wife thinks I sleep soundly every night. She doesn't know, no one knows that I'm lucky if I get 2 hours a night with all the worry. And I think that was, when I read that, I think that hit home really hard. And it just shows that actually, even if people are surrounded by people who love them and care for them, they can still feel very isolated. I think it was Jess said, you don't just because you're not alone doesn't mean you can't be lonely. And I think that kind of quote sums it up very nicely. So what was our response? Well, we designed a social marketing campaign to improve awareness of a 24-hour support line. So if people in the room know or have heard of the Mental Health Matters 24-hour, 7-day-a-week helpline that is staffed by people trained in counselling skills up to level 3 as a minimum. We are using that phone number as the end point to our social marketing campaign, so that we are providing people with an option to get help at whatever time of day or night. This is what the campaign looks like. Hopefully some of you will have seen it either out and about. We've been on the backs of buses. We've been at Gillingham Football Club, have got hoardings around us. We've been in pubs, clubs, transport stops. We've been on petrol pumps in supermarkets, trying to get the message out and about around this kind of helpline. And in addition to the paid-for advertising, we've also done the old-fashioned route of kind of leaflets and postcards, and we've got a stand outside, which either myself or my colleague Antonia will be dishing out cards as you go out from the conference today. So please take as many as you feel you can get rid of, either in your workplace or your voluntary groups that you're involved with. I've got 6 boxes in my car, and our office is on the 3rd floor, so I do not want to have to take them home. But this is what it looks like in video format.
The stresses of everyday life can soon build up. But talking about them can help. So if you know someone who's feeling the strain, get them to speak to the people at Release the Pressure. Don't let them suffer in silence. Call today or find out more at releasethepressure.uk.
So I should say that we designed the campaign with men in mind, but it is not exclusively for men. So anyone over the age of 16 can call that number and be supported. And in fact, you can work out from the stats up on the screen that we still get a majority of female callers. So despite the fact that we've seen big increases in the number of men calling, which we're taking as a sign that some of our marketing and advertising has worked, we still are getting more calls from women, which we know reflects national trends that women are more likely to seek help. So that's some of the statistical impact. In terms of what people are saying, Again, these are some of the quotes from the service users. I'm so glad I called. I had no idea it would leave me feeling so positive just by talking to you. Your service has kept me alive. I would have killed myself if it wasn't for you people on the phone. And I'll leave you to read the rest. But we do think that it is making a real difference to people's lives when they call that number. My final slide is just around next year. The national lead, Tim, highlighted this possibility. He kind of teased us with it a little bit, that there is funding available for 9 STP areas up and down the country. We were tapped on the shoulder a few weeks ago and told that we are, partly because of our national rates, that we are one of those 9 areas where money is available. So thank you to everyone in this room, a number of people in this room who helped me put together the proposal in very short time over a couple of weeks ago. We have submitted a proposal, and if it's successful, and we should be hearing very soon, for that money, which will provide 12 months of funding to, as you can see there, support more training, more support for high-risk groups, more research. We know a lot about numbers in terms of quantitative research. We don't know an awful lot about qualitative research, so it'll fund some work there and some other things that you can see there too. That's it from me. I shall seamlessly hand over to Ian.
Hello, nice to see you. I know some of you, don't know all of you. I'm Ian Marsh. I used to work in a trust as an occupational therapist in mental health. If I'm slightly nervous, because I've never given a talk in front of my wife, Rosari, before. But she might disagree with that. She might think I give talks in front of her all the time. What I'll quickly run through is the project that's been going since October last year, which is the Suicide Safer Universities project. It's a project between Christchurch, University for the Creative Arts, University of Kent and Canterbury College have recently come on board. So it's actually around 50,000 students, the reach, and about 6,000 staff. And if you think about the population of Canterbury, it's a fair chunk of the local population, really. The reason we started the project was in response to concerns within Christchurch about a number of student deaths that we'd had that were suspected suicides. Certainly the first thing it says there about it being a low-frequency, high-impact event, we don't get many, but when we do, the impact across the university is huge. And that's in kind of cohorts of students, friends of students. Obviously, families are massively affected, but also staff. We have lots of security staff that are often first on the scene, and they can be quite impacted as well. In terms of national statistics, it's both the kind of data that is collected and the kind of anecdotal data suggests that it's an increasing problem around universities. Some of the figures there show the increase. I think the last count they did was about 134 student suicides in England and Wales in 2015. That's likely to be quite an underestimate because coroners don't necessarily record student deaths. They don't necessarily record them as students on their reports. And also students, if it happens in outside of term time or they've gone home, then universities wouldn't necessarily know. But you might have read stories. Bristol, I think, had another suspected suicide recently. So there's some national stories around student suicide as well. And it's kind of, I'll just give you a bit of the wider context about student mental health. And again, the figures that we have and anecdotally the people I've talked to in other universities, this graph would be pretty much reflected across the country. And it shows the increase in students that are disclosing mental health problems. And as you can see, it's a very steep upward curve. Our services were set up kind of over here. So our student mental health and counselling services were set up, and then, and again, other universities say the same things, and we feel, I'd say, overwhelmed, but it feels like that sometimes in terms of both the numbers of students with mental health problems and the complexity, and certainly the levels of risk within the population. The last time I checked through some of our statistics for the people known to our support services, about 20% were saying that they had had a previous suicide attempt, and 25% were saying that they'd have current thoughts of suicide. So I think the population we have are at particular risk as well. And again, the kind of evidence that's collected about young people generally, more broadly than universities, this is a graph about self-harm. And again, I think this is quite staggering, really. If you look at the trace from 2000 up to now, and the yellow lines, women, the blue lines, men. So it's gone just above 5%, up to now nearly 1 in 5 women, and that's 16 to 24-year-olds self-harming. But the rise is for men as well. In terms of gender, for the suicides we have, it's more men than women. In terms of what we have a project steering group set up. So we've followed a suicide safer approach, which is kind of piloted in the University of Worcester. So we've followed that approach, and we have Tim sits on it. We have Canterbury Samaritans. We do have some representatives from KMPT. Andy Oldfield has joined. We have Kent Police Network Rail, and also representatives of academics and other student support within the universities. And that's a kind of strategic group looking at resources and strategic decisions around trying to help our students. In terms of what else we're doing, we're doing quite a lot of stuff internally around education and training. So we're rolling out suicide awareness training and mental health first aid training for academic staff, as well as some of the other support staff. We've developed some resources for across the university. So we've got the It's Safe to Talk About Suicide, which Christabel Owens developed in the Southwest. So we've rolled that out across our campuses, and that kind of gives advice to students and staff about if they're concerned about people. And we've also kind of got our access to student support, and that has advice about helping suicidal or distressed students in it as well. In terms of our resources, we're really struggling. I know there's not endless pots of money around, and mental health services are under a lot of pressure, but we're really feeling at the moment the demands on us and the suspected student suicides we've had have meant that we feel it's really quite a fraught environment at the moment, to be honest. So we are working with Andy, and we're working with other kind of KMPT people to look at that interaction between our student support services and yourselves in terms of working in a more joined up way, in a more professional way, and also I think one of the things we get caught is our students, maybe there's a perception that they're already looked after, that they're getting lots of support, and they get some support within university, but our feeling is definitely that they often require kind of secondary services. The other issue we have, I think, at Christchurch is the University of Kent have a medical centre on site, so they have better access to primary care, and we struggle with that with our liaison with local GPs because they're not on site. In terms of what we are doing, unfortunately, due to events, we're getting quite good at the postvention thing. We've got very good at supporting students and staff after events, which I think is good prevention, so we're doing well with that. But we are still kind of working on the plan to get better support, particularly at the crisis end, really. And we're looking, as Tim was saying, as part of the STP bid, and generally we're also looking to do some kind of research, and I'm particularly interested in kind of men and help seeking and suicide, which maybe Johnny will talk about a bit as well. Right, thank you.